Health officials in the U.S. are bracing themselves for an upsurge in swine flu cases later this year. While regular influenza all but disappears in the summer, swine flu is still spreading. So officials are closely monitoring the outbreak in the southern hemisphere, where it's winter.
We are seeing this strain circulating actively in several countries, and it's circulating at the same time as the seasonal strains. And that's one of the reasons why we are pretty certain that there's going to be some important challenges with the 2009 H1N1 virus here in the U.S. in the months ahead.
The focus is also on the world's 5 leading flu vaccine makers and how fast they can produce the swine flu vaccine and how they plan to test that it works.
The worst case scenario would be that H1N1 comes in large measure, has a big outbreak very early before we have vaccine available.
Health officials in the United States are hoping to have 160 million doses of swine flu vaccine available sometime in October, but they may not reach that goal. The chief ingredient for the vaccine is grown in chicken eggs, and manufacturers are getting far fewer doses per egg. This week, the National Institutes of Health called for a few thousand volunteers from babies to the elderly for studies to see if pilot batches are safe and protective. Results of those trials may not come back until October.
Trying to find out whether the standard dose given once or twice versus a higher dose given once or twice gives you the level of a response that you know is predictive of protection. Once we find that out, then we'll know what to administer to the people when the decision is made to administer it.
Swine flu was first identified in April, and since then, there have been 37,000 confirmed cases in the U.S. and 211 deaths. Ross Simpson, The Associated Press.